What if your blood test says normal, but you still feel completely unlike yourself? That's exactly why so many women become confused about perimenopause. You wake up at 3 a.m., soaked in sweat. Your heart is racing. You feel anxious for no obvious reason. You can't sleep. And suddenly, even simple things are harder to remember. Then your periods start changing. Early 1 month, late the next, heavier, lighter, or suddenly missing. So you search perimenopause blood test. Which hormone test can tell me what's happening? Because you want one simple answer, one test, one number, one explanation. But here's the surprising part. That number may not tell you the story you think it will. Hormones can fluctuate dramatically during perimenopause. So a test can look completely normal one day and tell a very different story another day. And for many women over 45 with typical symptoms, the diagnosis may rely more on your symptoms and menstrual history than a hormone number. But, and this is important, there are situations where testing really does matter. So stay with me, because we're going to separate the useful tests from the misleading ones. The tests you may actually need, and the popular home tests you should think twice about. I'm Dr. Clara Bennett, and this is Perimenopause Unfiltered, the science behind your symptoms. First, let's fix the terminology. You may have searched for premenopausal blood tests. That phrase is everywhere online. But here's the truth. Premenopausal blood test is not a defined medical term. The term you're probably looking for is perimenopause. And the way perimenopause is diagnosed may surprise you, because perimenopause isn't simply a condition that can always be confirmed by finding one abnormal hormone number. It's a transition, and your hormones can behave very differently from one day to the next. The hormone roller coaster. Think about your hormones like a roller coaster. During your reproductive years, the hormonal pattern generally follows a recognizable rhythm. But as you move through perimenopause, that pattern becomes increasingly unpredictable. Hormone levels can fluctuate dramatically. Estrogen can rise, then fall, then rise again. FSH can be elevated one time and look different another time. So imagine taking a photograph of a roller coaster. You capture it at one exact moment. That photograph is real, but it doesn't tell you where the roller coaster was 5 minutes ago, or where it will be 5 minutes from now. That's one of the biggest problems with interpreting a single hormone test during perimenopause. The test measures your hormones at that moment. It doesn't necessarily capture the entire transition. This is why a woman can have significant symptoms and still receive a hormone result that looks normal. The number isn't necessarily wrong. It simply may not tell the whole story. So how is perimenopause actually recognized? This is where your age, menstrual pattern, symptoms, and medical history become incredibly important. For women aged 45 and over who have typical menopausal symptoms, current NICE guidance recommends diagnosing perimenopause or menopause based on the clinical picture rather than using routine confirmatory laboratory tests. That means your doctor may look at your age, your menstrual changes, your hot flashes, night sweats, sleep problems, mood changes, brain fog, anxiety, and the overall pattern of what's happening to your body. So here's the big takeaway. Perimenopause isn't always something you need to prove with a blood test. Test number 1, FSH. Let's talk about the test you've probably heard about most. Follicle-stimulating hormone. FSH is involved in communication between your brain and ovaries. As ovarian function changes, FSH can rise. So it sounds logical to think high FSH equals perimenopause. But it's not that simple. During perimenopause, FSH can fluctuate. One test can show a higher level. Another test can show something completely different. That's why a single FSH result shouldn't automatically be treated as the final answer. For women under 45, however, hormone testing can become more relevant depending on the situation. And for women under 40 with suspected premature ovarian insufficiency, repeated FSH testing may be part of the diagnostic process. Current BMS guidance recommends elevated FSH on 2 occasions, 4-6 weeks apart, alongside the clinical picture for suspected POI. So the important question isn't, is my FSH high? It's, why is my doctor ordering FSH, and what question are we trying to answer? Test number 2, estradiol. Next is estradiol. Estradiol is one of the main forms of estrogen. And yes, estradiol levels can fluctuate significantly during the menopause transition. But here's another important distinction. A single estradiol measurement is generally not a reliable way to diagnose perimenopause in women over 45 with typical symptoms. So why might a clinician measure it? There are specific clinical situations where it can be useful. For example, the British Menopause Society notes that serum estradiol may sometimes be considered when assessing estrogen absorption in someone using HRT, particularly when symptoms remain troublesome. So don't automatically think, Estradiol test equals perimenopause test. It doesn't work that simply. Test number 3, thyroid. Now we get to a test that can be extremely important, thyroid function. Why? Because thyroid problems can produce symptoms that look remarkably similar to perimenopause. Fatigue, brain fog, mood changes, sleep problems, weight changes, changes in periods, and other symptoms. So sometimes the question isn't, which test proves I have perimenopause? The better question is, could something else be causing or contributing to these symptoms? Your clinician may start with a FSH test and order additional thyroid testing when appropriate. This isn't a test for perimenopause. It's a test that can help investigate another possible explanation, and that distinction matters. Test number 4, iron and ferritin. Here's another one women often overlook. Iron, especially ferritin, which reflects stored iron. If you've developed heavy or prolonged periods during the menopause transition, you may gradually lose iron. Low iron can contribute to fatigue, weakness, difficulty concentrating, and sometimes palpitations. So if your periods have suddenly become much heavier and you're exhausted all the time, don't automatically blame everything on hormones. Your doctor may consider a blood count and iron studies, including ferritin, depending on your symptoms. Again, we're not looking for one magical perimenopause number. We're looking for the complete picture. Test number 5, pregnancy test. This one surprises some women, but pregnancy is still possible during perimenopause. Your cycles may become irregular, you may skip periods, but ovulation can still happen unexpectedly. So if pregnancy is possible, a pregnancy test may be an important part of the evaluation. Remember, menopause is defined retrospectively, after 12 consecutive months without a menstrual period, when there isn't another explanation for the absence of periods. Until menopause is confirmed, pregnancy can still be possible. What about AMH? You've probably heard about AMH, anti-Müllerian hormone. AMH is associated with ovarian reserve, essentially information about the remaining egg supply. But here's the important part. AMH is not a routine test for diagnosing perimenopause. It may have a role in fertility-related assessment or certain specific clinical situations, but current NICE guidance specifically advises against using AMH to diagnose perimenopause or menopause in women over 45. So don't let an online fertility test convince you that AMH is your definitive menopause test. It isn't. What about LH? LH stands for luteinizing hormone. It plays an important role in triggering ovulation. LH can also change as ovarian function changes. But on its own, LH usually doesn't provide the complete answer to, am I in perimenopause? So it's generally another piece of information rather than a magic diagnostic number. What about progesterone and the Day 21 test? You may also hear about a progesterone test, sometimes called a Day 21 progesterone test. Here's where you need some context. A mid-luteal progesterone test can be used to assess whether ovulation has occurred. But Day 21 only makes sense for a typical 28-day cycle, and it isn't a universal perimenopause test. In irregular cycles, the timing has to be interpreted differently. So don't assume that a low progesterone result automatically means I have perimenopause. The test is answering a different question. The shocking part, you may not need a hormone test. Now here's the part I really want you to remember. If you're 45 or older and experiencing typical menopausal symptoms, major clinical guidance says routine hormone testing is generally not needed to diagnose perimenopause or menopause. NICE specifically recommends diagnosis based on symptoms and clinical history in this group. The British Menopause Society similarly states that women aged 45 and over with menopausal symptoms can generally be diagnosed based on symptoms without confirmatory blood tests, unless there is uncertainty or concern about another condition. That means something incredibly important. Your symptoms can be more useful than your hormone number. So if you are 47, your periods have suddenly become irregular, you're having hot flashes, you're waking up at night, and you're experiencing brain fog. You don't necessarily need to chase an FSH number to validate what's happening. The clinical pattern matters. But what if your blood test is normal? This is where many women become confused. You have symptoms. You get a blood test. The result comes back normal. And you think, so I must not be in perimenopause. Not necessarily. A normal hormone result doesn't automatically rule out perimenopause. It may simply mean that the hormone measured was within the expected range at that particular time. This is one reason hormone levels can be difficult to interpret during a fluctuating transition. So don't interpret one laboratory result in isolation. Look at the entire clinical picture. Be careful with at-home menopause tests. Now let's talk about something that deserves a warning. At-home menopause test kits. You may have seen urine FSH tests advertised online, or saliva hormone tests promising to tell you exactly where you are in menopause. Be careful. The British Menopause Society does not recommend over-the-counter menopause tests because they typically measure FSH without considering the wider clinical picture. And a single urine FSH result cannot capture the constantly changing hormonal environment of perimenopause. Saliva hormone testing also should not be treated as a reliable way to diagnose perimenopause. Most importantly, do not use these tests to make decisions about contraception or fertility without appropriate medical advice. What if you've had a hysterectomy? There's another group of women we need to talk about. If you've had a hysterectomy or certain procedures that prevent you from tracking normal menstrual bleeding, you can't use your period pattern in the same way. That makes the clinical assessment different, but it does not automatically mean I need every hormone test. Current NICE guidance notes that menopause can be diagnosed based on symptoms in women without a uterus. However, depending on your age, symptoms, surgical history, and whether the ovaries remain, your clinician may decide that additional investigation is appropriate. So tell your doctor exactly what surgery you've had. That information matters. Don't forget the conditions that can mimic menopause. If your periods have stopped or your symptoms don't fit the usual pattern, your clinician may investigate other causes. Depending on your situation, that could include thyroid problems, iron deficiency, pregnancy, medication effects, and other hormonal conditions. Prolactin may also be considered in some people with absent periods to investigate other causes. And if you're under 40 with significant cycle changes and menopausal symptoms, premature ovarian insufficiency needs to be considered rather than simply assuming normal perimenopause. This is why good menopause care isn't about ordering the biggest possible blood panel. It's about asking the right clinical questions. The most powerful thing you can do before your appointment. Start tracking. Not tomorrow. Today. Track your periods. When they start. When they end. Whether they're heavier or lighter. Any spotting. Track hot flashes, night sweats, sleep, mood, anxiety, brain fog, energy, heart palpitations, and anything else that feels different. Because when you bring 3 months of information to your doctor, you're no longer saying, I just don't feel like myself. You're saying, here's the pattern I've been experiencing. And that can completely change the conversation. 5 questions to ask your doctor. Take these with you. Question 1. Based on my age, cycle changes and symptoms, could this be perimenopause? Question 2. Do I actually need hormone testing, and what question would the test answer? Question 3. Could something else, such as thyroid problems or low iron, be causing or contributing to these symptoms? Question 4. What symptoms should I continue tracking? And question 5. What treatment or management options should we discuss? Those questions move the conversation away from, give me a menopause test, and toward, help me understand what's happening to my body. Final message. So, can a blood test tell you that you're in perimenopause? Sometimes tests can provide useful information. Sometimes they can help investigate other conditions. Sometimes they are important because of your age or particular medical situation. But there is no single magic blood test that tells every woman, yes, this is perimenopause. And especially if you're 45 or older with a typical pattern of symptoms, current guidance supports a clinical diagnosis rather than routine hormone testing. So if you've ever received a normal result and thought, then why do I feel so different? Please remember this. A number does not define your experience. Your symptoms matter. Your menstrual history matters. Your medical history matters. And you deserve a healthcare professional who looks at the whole picture. You are not imagining it. You are not broken. And you don't need to become an expert in every hormone number before you deserve answers. Track your symptoms. Write down your questions. Take that information into your appointment. And ask for a proper clinical assessment. Because understanding what's happening inside your body is the first step toward knowing what to do next. If this video helped you understand perimenopause testing, share it with another woman who may be searching for the same answers. And tell me in the comments, have you ever had a normal blood test while feeling anything but normal? I'm Dr. Clara Bennett. This is Perimenopause Unfiltered, the science behind your symptoms. See you in the next video.